Assalamu alaikum wa rahmatullahi wa barakatuh. Good day, everyone. My name is Dr. Rakan Al-Mughir from the Saudi Patient Safety Center, and I'm part of the Choosing Wisely team. I'll be talking today about the key principles in choosing wisely. Again, the aim for the Choosing Wisely initiative is to promote conversations between patients and healthcare providers about unnecessary tests, treatments, and procedures. And the goal is to reduce unnecessary medical interventions, which can lead to better patient outcomes and lower healthcare costs by providing care that is evidence-based, not duplicative, harm-free, and truly necessary. So some of the key aspects of the Choosing Wisely initiative are the healthcare worker engagement, patient-provider communication, educational resources, reducing overutilization. Healthcare worker engagement can be done by conducting grand rounds, conducting competitions, and undertaking recognition programs, and engaging the junior staff first. Patient-provider communication to promote the shared decision making, and we will come to that at the end of this presentation. Educational resources for both the patients and the healthcare workers, reducing overutilization leading to less harm, better outcomes, and less cost. Also, quality improvement by the higher quality and less harm care, proper utilization of resources, multi-stakeholder collaboration from providers, patients, professionals, societies, leaders, and policymakers and insurers, continuous assessment and updating for emerging sources of harm and waste, and updating the lists of recommendations. So, talking about choosing wisely and how do we approach it, it's better to be approached by a systematic approach. First, by engaging the relevant stakeholders, collaborating with healthcare professionals, including physicians, nurses, and other staff members, to create multidisciplinary team, ensuring representation from various specialties and departments within the organization, involving the patients and advocacy groups to provide valuable insights into their experiences and perspectives on healthcare interventions. The second point in the systematic approach is reviewing existing data within the organization, including clinical outcomes, utilization rates, and cost data, and the literature by conducting a comprehensive literature review to understand the latest evidence-based practices and guidelines relevant to the organization and organization's specialty. Third point in the systematic approach is utilizing Choosing Wisely recommendations, and we have that in the Choosing Wisely website. Leveraging quality improvement initiatives. The fifth point is conducting chart reviews to assess the appropriateness of tests, treatments, and procedures in each patient chart, and conducting also peer reviews, letting the other team members or other healthcare providers evaluating my work or my colleagues' work. The sixth point is surveys and feedback, administering surveys to healthcare providers to gather insights into their practice, beliefs, and awareness of evidence-based guidelines. Feedback from the frontline staff can provide valuable information about perceived barriers and facilitators to implementing Choosing Wisely recommendations and implementing change. The seventh point is data analytics and technology, utilizing the analytics and information technology to identify patterns and trends in healthcare utilization is of so much value to the Choosing Wisely initiative. The last point is continuous monitoring and evaluation, establishing the system for continuous monitoring and evaluation of the impact of intervention aimed at reducing unnecessary tests and procedures, and regularly reviewing data and adjusting the strategies as needed to achieve the sustainable improvement. So how the recommendations are developed in the Choosing Wisely initiative. So there are 5 steps for the recommendation development in the Choosing Wisely initiative. First, we request the recommendations from the scientific societies annually in the Saudi Commission. Then the scientific committees or societies share the recommendations with the Choosing Wisely Scientific Committee. We review them and share back the feedback with the scientific societies, rectify and work on the comments, then share back with the scientific societies. Then we share it and upload it to the Choosing Wisely website. So there is a criteria for developing Choosing Wisely recommendations. The first one is that each recommendation should constitute of 2 parts. One part for the healthcare providers and one part for the patients. The second point is that the recommendations must include original references, scientific and evidence-based. The recommendation provided should be one of the priority list in healthcare system, and this is based on the expert's opinion or current data in the system. If it is adopted from an international society, we have to make sure that it is suitable for the healthcare practice in Saudi Arabia. So here are some examples of patient educational materials that we publish during our initiatives. So if you look in the literature, there are many patient engagement levels described in the literature. One example of which is shown in this slide from the patient engagement framework by the NHS. It is divided into 3 levels: information, where the power lie with healthcare professional, service provider or system. Involvement, patient have an active role, but powers lie with healthcare professional cell. Then the last one is partnership or shared leadership. Patients share power with healthcare professional, service provider or system. Another example of some of the stages of patient engagement described in the literature. Here we have 6 levels of patient engagement. The first one is informing. We as healthcare providers provide patients with essential information about their conditions, treatment options, and care plans. Then the next level is consulting, where patients are moved from merely being informed to becoming more active participants in their care, but still their voices are acknowledged but not acted upon, and they don't have the ultimate decision-making power. Third, we have involvement. As patients' engagement intensifies, patients become actively involved in their care, and the healthcare providers encourage patients to actively participate in shared decision-making. They weigh the treatment options and contribute to care planning. The fourth level is collaborative engagement, where healthcare providers and patients work together as equal partners in the care process. The patient's values, preferences, and goals are fully considered in the treatment plan and decisions. The fifth level extends beyond collaboration, which is partnership. Here, the patients have an active role in co-designing treatment plans and healthcare policies. The last level, which is at the pinnacle of the spectrum, called empowerment. Here, the patients actively lead their healthcare journey. Empowered patients are equipped with the knowledge, skills, and confidence to make informed decisions, manage their conditions, and take charge of their overall health and well-being. So this is one of the tools that empower patients in the Choosing Wisely initiative, called 5 Questions to Ask Your Doctor. It is by the Australian Choosing Wisely. We can provide these to patients during implementation of the Choosing Wisely initiative in the waiting areas or at the emergency departments and inpatients. They will provide the patients with 5 questions that give them a sense of how valuable is the intervention or test or treatment that will be given by the healthcare provider. So also the Australian Choosing Wisely, they provided a sheet for the healthcare providers to answer these 5 questions and help them consider, is this treatment or intervention really matters to the patient and is really valuable or not. We are talking about shared decision making, but what is shared decision making? So shared decision making occurs when a healthcare provider and the patient work together to make a healthcare decision that is best for the patient. The optimal decision takes into account evidence-based information about available options, the provider's knowledge and experience, and the patient's value and preferences. The shared approach by the AHRQ includes 5 steps to shared decision making with the patients. It is available open source online for everyone who will dive more into the shared decision making and to how empower patients about partnering or collaborating with them in the shared decision making process. These are some further reading materials for your knowledge. Thank you all for attending and see you later.